helping make your life easier. Moms Every Day.
Hi guys, welcome to Moms Every Day. I'm Hattie Cheek. We have Dr. Claudia with us today, Dr. Valuri, and some really exciting news that you have brought for us. Not something that you usually hear coming out of West Virginia. They're here from Cabell Huntington Hospital. You've invented something that could definitely make a big impact. It's called ChemoID. Tell us a little bit about it.
Okay. Well, ChemoID is a second-generation CLIA certified drug response test. It is a test that allows an oncologist to dial the right chemotherapy treatment to a patient before the patient actually undergoes it. And cancer is a very unique disease, very individualized disease. So it is as unique as a person who's fighting it.
Right.
And so we need really chemotherapies tailored to that particular tumor.
So it really helps with the process when someone's diagnosed with cancer. They actually have this thing that can help designate which chemo they're going to be getting, because I'm sure that's a very hard time and a hard decision to make.
Right, right. And also this ChemoID is truly a second generation test, because this test allows us to really find not only the best chemotherapy against the bulk of tumor cells, but also against the seeds of cancer. These are called the cancer stem cells. So this is all new information. And so by dialing chemotherapy not only towards the cancer stem cells, which are the drivers of tumor recurrence, tumor metastases, and tumor regrowth, you're actually shrinking the tumor with the best possible combination so you can have a prolonged clinical response.
But how does ChemoID work? And do you need tissue from the cancerous tumor, or how do you go about that?
The way that this test works is that the oncologist will prescribe the test, and a biopsy will be taken from the patient, live biopsy, which then comes to our laboratory. And through a process that we have validated and experimented in humans also, we have done clinical trials, we can tease out the cancer stem cells, enrich them, and then we can dial chemotherapy against the cancer stem cells and provide the information to the oncologist, who may exclude drugs that may not work on that particular individual and in that individual cancer.
So it kind of just whittles it down, so you know you're not getting something that absolutely wouldn't work for you, because I'm sure a lot of people go through processes where they're like, okay, this didn't work, we need to start something else. And that can be just so frustrating, on top of just the fact that you're dealing with cancer right now.
Exactly.
And we spoke, and there are so many different treatments that you could possibly be getting. Can you talk about that at all?
Sure.
And how many different kinds of possible treatments there are?
Yes, there are. Especially when a patient is first diagnosed, there are first-line treatments, and those are usually a restricted number of therapies that are approved for treating the cancer. When a patient recurs, then there are many more choices available, second-line treatments, and then at that point the oncologist has a real problem in trying to understand which therapy will be best, because time is of the essence, first of all. So we are running out of time, and so patients need immediate treatment. And the other consideration that we need to do is that because so many treatments are available, and those are all approved by general randomized clinical trials, they determine basically an average response. And because patients are, and their cancer is really different from the person to person, they may not respond the same way. So this actual test that we have developed helps taking out of the picture those drugs that may not work.
The trial and error
The
type.
trial and error type, that's what oncologists do today. Try a drug, hopefully will work because it's the best choice available among all the choices they have, and then they move on to the next drug and the next drug.
Right, and what's really interesting, you guys developed it right here in Huntington.
That's correct. So what